Good afternoon, Scranton. I hope that you are all well on this snowy Friday, the last Friday of January, a month that I'm looking forward to getting over with. It's been a long one. It's been a good one, though. Great week for the city of Scranton. On Tuesday, the state of Pennsylvania released us from 30 years of distressed status under Act 47. So we are very excited about that. It does not mean that we don't have a tremendous amount of work ahead in the weeks, months, and years, but very happy to have that status off of us so that we can move forward. And we'll still have the support of some of the team that has been supporting us until now. We'll keep working with them until we make sure that we've got all the tools we have internally at the city to properly manage everything. But we're exciting. It was an exciting week. And we move forward. So we'll keep doing these town halls this year. Today, I'm excited to be joined by the acting consumer advocate for the Commonwealth of Pennsylvania, Patrick Cicero. I asked Patrick to come on today because, as some of you might have seen over the last week, the conversion to 5G has some real implications for people, especially people that have certain types of mobile devices. And we wanted to make sure and hear it right from the source from Patrick of what people need to be doing to make sure that their communications stay updated as this conversion goes on. So Patrick, thank you so much for being with us. We really appreciate you virtually joining us in Scranton.
Thank you, Mayor Cognetti. I appreciate the opportunity to speak to you and to speak to everyone from Scranton and everyone across the web. Let me first just briefly talk about the Pennsylvania Office of Consumer Advocate, if you don't mind. We are a state agency, and our office was created in the mid-1970s to fill a gap that has long existed in the representation of consumer interests before the Pennsylvania Public Utility Commission and federal agencies that do not only utility advocacy, but telephone-related work. And so we at the PAOCA believe that everyday Pennsylvanians need to have advocates that are just as good or better than the utilities that are coming for the PUC or the Federal Communications Commission, and ensuring that consumer voices are heard to make sure that rates are fair, just, and reasonable. And so that's what we do. On this issue about the shutdown of some of the 3G network, which I think is really, really important. I just want to make sure that we get the word out about this. And so what's happening? Beginning in January, beginning of this month, the major carriers, and the major carriers for purposes of mobile phone are AT&T, T-Mobile, and the former Sprint, which is now a part of T-Mobile, as well as Verizon, are beginning to shut down their 3G networks. And it's a rolling shutdown. Some of it in February, some of it in March and June and July, and then Verizon not until December. So that means for consumers who have older mobile phones, and we're talking about 2012, 2013 or before, those phones will no longer be able to make voice and or text calls after the network has shut down the 3G network. And it's not just people with AT&T, Verizon, or T-Mobile. If folks have a prepaid carrier or a kind of a secondary carrier like Boost or Cricket or Straight Talk Wireless, they use the carrier services, they use the towers of AT&T, Verizon, and T-Mobile. And so those services for older phones will not be able to work. And this matters for a couple of reasons that are really important. One is you won't be able to make even emergency 911 calls from these telephones any longer. Some people have an older phone that they keep that no longer has carrier service because they've been told, rightfully so, that they can continue to make 911 calls with that, even if they don't have service. While that will remain true for phones that are operating on the 4G LTE network and beyond, that won't be true for these older phones. So if you have an older device that you're keeping around for emergency purposes, that's no longer going to be available. And then the other thing I want to mention, I'll kind of we can have some conversation about this as well, is this is not just for telephones. Many seniors and older Pennsylvanians rely on medical alert or life alert, these kind of emergency systems in their homes. Those have historically operated on the 3G network. And so it's really important that you reach out to your provider of these medical alert and life alert services to make sure that they are no longer working on the 3G network. And if they are, you get a new device that operates across the 4G network that's been rolled out. We don't want anybody to have a situation where they need those services and can't use them. For the most part, carriers will be reaching out to consumers who are affected by this. And for the most part, some of these life alert and medical alert carriers are supposed to be doing it too. But if you have a question about this, don't wait. Reach out to the provider of your service. That's really critically important. And I can talk a little more about what you can do if you can't afford it here, but I don't know if you had any questions or if you wanted to ask any clarification about things that I just said.
Wow, that I did not know the life alert piece. I think immediately of my grandmother. So that was very useful information that I'll be taking to my family today. Do you know to the point about cost? Do you know if some of these companies are helping with cost, or if in the case of like a life alert, I don't know if there's any healthcare coverage that maybe helps, or if there's programs through your office or through other entities that can assist?
Yeah, it's a great question. Let me talk about the life alert question first. Generically speaking, these are called personal emergency response systems, and they're branded as either medical alert, life alert, fall monitor. Kind of the best place to go if you can't reach your own provider of this, if you've subscribed to this service, is your local area agency on aging and the Department of Aging. They do have resources about this, and they do have some services that are available. So the area agency on aging and the Department of Aging kind of can help with that, and or particularly if you can't get a hold of who your provider is, to be able to get a replacement device. That's going to be your best bet in terms of the personal emergency response systems that may be affected by this. In terms of the telephones, the mobile phones, and or I should mention some tablets that have data. So if you have an iPad 2, for example, that's no longer going to work on this system. So older tablets that might have data services as well could be affected. The carriers, again, should be reaching out and providing opportunities for replacement devices. If you have a device that is 2012, 2013 made, there may be software updates that can be pushed out by the provider to allow you to continue to use that device. And the one thing I want to make sure I mention is we're talking about 3G, but some carriers have branded what were 3G phones as 4G when 4G just started. So don't rely on the fact that your phone says that it is 4G. This early designation of 4G only referred to some of the broadband network and not the voice network. The voice network wasn't a high definition voice network. So it really is just a high definition HD 4G that's going to be available after this. So if you have a question about it, even if you think, oh, I don't have that old of a device, it doesn't hurt to call your carrier about this. In terms of assistance, I want to talk about two things. One is there are two programs that are available for low and moderate income households. The first one is the Lifeline Program. This is a program that will be able to provide a discount on your mobile phone, up to $9.25 off on mobile phone or internet bills for households that earn 135% of the poverty level or less, and or meet some other eligibility guidelines. Some of these providers provide free devices, actually free handsets, and provide a discounted number of minutes every month. And so you can get access to a Lifeline phone by, I will make sure I provide your office with the right information, but it's on the website, fcc.gov/Lifeline, and that will get you to the Lifeline program. So that discount of $9.25 a month and a handset is almost universally available across service territories. The other piece of this is there's also the Affordability Connect program for broadband and data that I want to mention. That provides a $30 a month discount for households with incomes up to 200%, 2 times the federal poverty guidelines. So it's $30 a month off broadband access, and you can combine both of these together, right? So you could get on the Lifeline program and support, you could apply that $9 discount to internet bills or a monthly phone. So you could use the Lifeline benefit to get a phone, a mobile phone, and the broadband benefit to get kind of broadband in your home to the extent that's available and get $30 off. You can combine those programs to kind of remain getting connectivity. That would be helpful for vulnerable households. For households above those income guidelines, and I know many households are still struggling even though they're above those income guidelines, reaching out to your carrier and asking if they have any deals because of their 3G shutdown. A lot of carriers are doing really good deals on phones that will work on the 4G spectrum. So I would just urge folks to reach out to both of those assistance programs as well as their carrier.
That's great. Really, really important. These things come, I know that folks like you have been working on these things, I'm sure, for a while. And then when it comes out into the public, it always seems like something that we haven't been anticipating. So it's always important for us to continue to get the information out. If your office has information, the information you just went through, if there's something that we could put out as a graphic on our social media and make sure that people know those links and where to go. The voice piece, of course, is so important with if your phone is no longer going to work for emergency calls. The life alert piece was a surprise to me, and I am grateful that you mentioned that. Those are these things that you just wouldn't think of. And as technology continues to be kind of in every piece of our lives and even in some people's bodies, really, we need to make sure that we're being diligent and getting this information out is really, really important. So the upshot really is if you know someone that has an old flip phone, it's probably on 3G, that is going to be eliminated. That phone is no longer going to work over the course of, is it the coming months that you would say, or what's the timeline? Do you know in Pennsylvania?
I do. And it's, so I wanted to make clear that's not just a flip phone. If you have an iPhone 5 or earlier, that's not going to work. Right. And lots of people might have those. And so it could be a device that, looks like a smartphone or is a smartphone, but it's an older smartphone. And I know many people, my parents and grandparents included, like to hold on to those for long periods of time because they don't want to buy more of them. So, they're affected by this. AT&T is completing its shutdown in February. So it's already started in various places in February. T-Mobile/Sprint has kind of a rolled out approach between March and July. They're kind of taking off various pieces of their network. And Verizon consumers will have until the end of this calendar year, until December 31st, 2022, before their network is shut down. I would just urge people not to delay. The carriers' websites all have information about this on, and they will be reaching out to folks. The folks who probably are going to most likely be missed in that are people who brought their own phone to that service, and again, who use Boost or Cricket or Straight Talk Wireless or one of these other prepaid carriers, which provide good service for a lot of people. But you have a different relationship with that carrier than you would with some of the others, and so it's important for you to kind of get some information about this. And so if you have a doubt, reach out to whoever your provider is. They'll be able to tell you if it will be able to continue to work. The last thing I want to mention with this life alert system, the other kind of area that's affected is these vehicle SOS systems, right? So think about the branded one that most people know about is like OnStar, right? So some older versions of that are like the older versions of the life alert system. They operate on the 3G spectrum. And so the vehicle manufacturers and the subscription services to that are supposed to be providing updates or letting people know. But again, if you have an older model vehicle that uses one of these vehicle SOS systems, you may want to just check with your subscriber, the service you're subscribing to say, is this going to remain and continue to work when the 3G network gets shut down?
Okay. That's really, really helpful. So if you can share that with us, we'll share the information from you all, from the Office of the Consumer Advocate out there. I know I'm getting comments. People are not sure why we're talking about this. It's really important, I believe, for us here at the city to get this type of information out. It's easy to miss these types of things. We get a lot of mail, for example. It's really easy to throw out something that you might have gotten. You thought it was a cell phone bill that's already on auto pay or something, right? It's easy to miss these things. So I see it as part of our role is to continue to get information out that could save someone's life. And in this case, that's, I think, what we're potentially dealing with. So I really appreciate you coming on, Patrick. I hope we get to meet in person at some point over the course of the next year.
Thank you for having me. And our office is a resource. I provided to your office our 800 number, our consumer call center, if people have questions, not only about mobile phone, but about any of their utilities, electric, gas, water, our office has a call center to help. And we are a state agency. We represent the interests of consumers before the Public Utility Commission and other agencies. And so happy to be a resource to your constituents and all Pennsylvanians.
Patrick, thank you very much. We really appreciate it.
Thank you.
All right. I see some folks not understanding. It is our job to get information out. Life alert phones, people that still have those phones, if they are going to not work and people won't be able to call 911 from the phone that they think should work, it's very important as a public service for us to get that information out. So we will continue to identify issues that are important to our community, and every single way that we can get information out, we will. I'm sure the news organizations will be covering these pieces as well. But an example, right? My grandmother doesn't have Facebook; she doesn't use the internet. But I just was able to text my father with the information about Life Alert, so he could get that to her. So it's also on us that do use different types of media to get good information to our family members. So we appreciate Patrick for coming on, and we'll get more of that information out to you all. Their COVID cases had gone down, and they're still down relative to earlier in the month, but still high. Scranton City Hall and Weston Field are still closed for that reason. And we're still seeing, people in Lackawanna County dying of COVID, people across Pennsylvania dying of COVID. So please be respectful of others as you go about your days, and we'll continue to watch the numbers and hopefully open City Hall back up as soon as we can. For testing, there still are a range of places where you can get tested. Believe that the county and interim healthcare service is still available down at the movie theater at 301 Lackawanna Ave. There's also testing capabilities at Delta Medics, DiPietro's, Medicap, Hometown Healthcare, all provide that. So still going, but hopefully in the coming weeks, we'll see the numbers tick down and we'll be able to start to get back to normal. Okay. Let's see. Couple of things. Let's see. Looks like this Saturday, so tomorrow, 11 to 5 at the Scranton Cultural Center, there will be 50 vendors for the Uniquely Different Craft Market, the Curiosities Uniquely Different Craft Market. Admission is $2, and the $2 admission will go to the restoration of the Cultural Center. Kids under 6 are free. Then Saturday and Sunday, up at Street Cats and Dogs at NAOG, there is a perfect match adoption event, cats and kittens available for adoption up at NAOG Saturday and Sunday, 12 to 3. For food pantries, you can go to neighborlypa.org, or you can call, if you want to call Valley View Terrace, their number there for that pantry is 348-3119. The Jackson Terrace phone number is 348-4429. Okay. And then Scranton Counseling Center, if you or someone needs help with behavioral health issues or addiction, 348-6100. Outreach, 348-6484. The Women's Resource Center is always 346-4671. And the Children's Advocacy Center asks you to call this phone number if you suspect child abuse, 1-800-932-0313. For smoke detectors, the City of Scranton can take your request, and we'll be able to install the new smoke detectors and CO detectors. The phone number for us is 348-4132, or you can email smokedetectors@scrantonpa.gov. Okay, so get into lots of activity today. Okay. For our income tax, 3.4% local tax. We would love over the coming years to be able to whittle that down. That is a medium-term goal to be able to do that. We have to to stabilize some of our other revenue sources and make sure that they go well. But we're hoping to be able to bring that wage tax down over time. That requires us to grow our city, get more families moving in, more well-paying jobs here, make sure that we're matching people with job opportunities. But the more that we grow, the more likely it is that we'll be able to get those taxes down over time. Okay, Mattis Avenue, my team will take that down and get that to DPW. Mattis, I'm not sure if that's one of our roads or not, but we'll get that in. I appreciate the shout out to DPW. They're out again today, which we appreciate as it continues to snow in this long month of January. Sharon, we are very much hoping that the park at North Scranton Little League will get built. There is a active permit for that to get built, and we're certainly hopeful that that will happen very soon. Okay. Once again, we do not run the school district, so I understand there's lots of chatter about different contracts and things. That is the school district's purview, and not a process that we run here at the city. The smoke detectors are free, so if you email smokedetectors@scrantonpa.gov or give us a call, we can set that up. Our number 348-4132. Let's see. Okay, Steve, if you can email 311 maybe with a little bit more information, JP, we can get that to Steve and check in on that issue. Okay. Oh, the other piece is we have a survey out that we're really encouraging people to do. This will help us plan for the future. We're doing a long-term strategic plan. You'll see the link to the survey on all of our social media platforms. Please do fill it out. It takes, I think, 4 minutes, and it really will help us understand what's important to you. And that will help us as we put this plan together and make sure that we're allocating our resources in a way that helps everyone in the city. The long-term plan includes, for all of our strategy, it includes housing, it includes solving for homelessness. So these pieces are all interconnected, and we know that that's very important. There's a lot of different ways that we can work on housing. It's a long-term goal, but we will continue to do that, and we'll continue to partner with all of the great social service organizations in the city and continue to advocate for more resources for them. The same with mental health and behavioral health issues. We continue to support those social service organizations, and we're working right now with the County District Attorney's Office and the Drug and Alcohol Programs Office at the state to be able to get more resources. Dr. Rachna Saxena, our public health coordinator, is heading up that effort for the city, and it's very, very exciting. Okay. Right, so that same goes for violence prevention. We're looking at what other cities do and trying to understand how we can work on those solutions here in the city. We really, really need to work on these things as a society. We had a setback at the state Senate this week, where the state Senate voted to penalize cities further that already can't do anything on gun control. My hands are tied. I'm preempted by state law from really doing anything on gun control. But just to add insult to injury, this week the state Senate voted to penalize cities further should they try to institute more gun control rules. So, Kimberly, we are out front on this issue and pushing to get rid of that preemption, and we'll keep advocating for that as mayors of cities like ours in Pennsylvania. Overcharged rental properties. We're looking at all of the ordinances that we have around rental registration and rental properties in the city. So that issue is something that we'll have to look at with the help of our attorneys. Okay. If you have a particular complaint, you can email or call into Scranton 311. We're happy to take that information and look into it. I think Paula's question is about Scranton Counseling. Scranton Counseling is absolutely a resource for the community. Their phone number is 348-6100. Outreach provides similar services at 570-348-6484. Jewish Family Services also provides mental health counseling. They're at 615 Jefferson Ave. Yep, Josh, we are always thinking about lowering taxes. We're always looking to grow the city and be more efficient with our services here at the city. We've done a really good job with that in the last couple of years, and we're going to keep doing that. So we'll keep at it, and really hope that we can find some more revenue streams, some different revenue streams. We'd like to not have to raise real estate taxes much. I mean, it's an inevitability, I think, but we'd like to limit that, and we'd like to be able to do it incrementally over time. And again, I'd love to see that wage tax go down. Nothing that we can ever guarantee on that, but that is absolutely a goal of ours. Okay. All right. Yeah, I'm not going to answer personnel questions on this forum, but thank you for your questions. Okay. Lowering the trash bill. We actually have a relatively low fee for the service that we provide. We know that from looking at other fees in the region. So I don't see the trash fee going down. We've been able to keep it steady the last couple of years, and hopefully we'll be able to continue to keep it steady. I'm not sure what the question about CDBG funds are. Debbie, if you have a more specific question about CDBG funds, I'm happy to forward that on. You can send it to 311 and we can, I'm not sure. Yeah, I need more information to answer your question. So if you can send that to 311, we'd be happy to send that on to that department. All right. Thank you, everyone, for participating. Again, really important, I think, that we get this type of information out about the 3G to 5G switch. These things might seem little, they might seem trivial to some of you out there, but they can be really important and life-saving for folks that have that technology that's about to fall off. So really appreciate it. Please stay safe out there this weekend. Wear a mask and be respectful of others when you're inside. And hopefully in the next month or so, few weeks, we'll be able to get back to a little bit of our normal lives. That is certainly the goal. So thanks, everyone. Have a great weekend.